Good morning, and thank you for joining us for our Apparatus webinar featuring Senior Technologist Katie Jenkins as she presents Optimize Your Day with Dashboards. This webinar will be recorded and made available to view after the presentation. Following the webinar, we'll have time for questions and answers, but feel free to send those over at any time. And now I would like to hand things over to our MC for this webinar, Rick, who will kick off our presentation and introduce our speaker.
Welcome, everyone. I'd like to introduce Katie Jenkins today. Katie is a senior technology analyst here at Apparatus and has over 2 years of business intelligence experience. She's created dashboards for a multi-hospital network. She's assisted in creating a meaningful use Stage 2 compliance system and has also worked on numerous data warehouse implementations. Thank you, Katie, for taking the time today.
Thanks, Rick. So we're going to start off today, we'll go over this agenda. We're going to start off with some dashboard basics, and then we'll go through different dashboard metrics for the various healthcare roles that we have. So Mary Beth, at the end of this, will also send a guide as a takeaway. That guide is framed as 5 ways dashboards will make you more efficient. But instead today for this presentation, we're going to frame this more as how we use dashboards to make different hospital roles more efficient. So first we're going to start off with some dashboard basics. So you should never send out a quote-unquote dashboard as an emailed report. Dashboards should never be emailed out. They should always be portal-based and something that people can access at any time, day or night, as they please. Additionally, dashboards should always have a live data connection. That is to make sure that when someone logs in, what they're seeing is always the most up-to-date version. They aren't seeing just a static report that you've placed out there for, say, like the last 7 days. We want to make sure that what they see is always the freshest copy of the data.
Katie, what if my data warehouse is a day behind?
Even if your data warehouse is a day behind, it's always important to have a live data connection. So if I log in today, I'm going to see what is the last 7 days of data, right? Which theoretically is going to be like day 1 through 8 in terms of today. But we always want to have a live data connection so that the data is always freshest and people can always rely on the fact that that data is the freshest copy.
Right.
So you never want to make what we call a heavy dashboard. Studies show that the humans can't fully absorb more than 7 dashboard panels. So you never want to exceed that number when you're creating a dashboard. Additionally, it helps to always make things symmetric. If you're going to have 2 rows, have 2 rows of 3 dashboards or 3 dashboard panels or 2 rows of 2 dashboard panels. It's important to always lay it out in such a manner that it's easily absorbed, kind of instantaneously when you look at it. There's an understanding. You don't have to search for information and go through that information in detail in your mind. The same principle that goes for data warehouses and for any type of analysis is garbage in, garbage out. You have to make sure when you're building dashboards that the data you're feeding those dashboards is accurate and can be relied on for the organization. Just always remember that when you do any type of analysis, that your analysis is only going to be as good as the raw data you start with. Finally, use familiar chart formats. In particular, I really hate stacked bar charts. I think that they're very, very hard to understand. So stick with things that people can look at and read instantaneously, right? Stick with trend lines and regular bar charts, that kind of thing, things that are easily understandable. There are a lot of trendy charts out there right now. Spark lines tend to be very trendy, but a lot of times that's just not really easily understood. So you want to make sure that you stick to dashboard panels that are easily understood by the user. Next thing we're going to talk about in dashboard basics is key performance indicators, which are abbreviated KPI. If applicable, you should always include a KPI or a goal in every dashboard panel. That way we can you see this matrix that's here on my slide. We talk about that matrix of being insightful versus actionable and what things are most useful on a dashboard. So, long-term goals, it's nice to check in with those on a dashboard, but those aren't going to be actionable. We want to stick to things on dashboards that people can take instant action to make that metric better, to make it look better, in short order. And additionally, obviously, you want to stick to the most insightful metrics that you have. And we like to be in kind of that upper right-hand quadrant. That's the most useful data points. Make your KPIs understandable at a glance. You always want to make sure, right, if you've got a trend line, that KPI is a big orange line or something that's going to stick out in people's mind, and they're going to understand how their data looks relative to the KPI and what improvements need to be made to meet that KPI. Finally, when you use indicators, always use a combination of color and shape to express meaning. Over 10% of males are colorblind, so if you're using a plain circle indicator and it's always going to be red, yellow, or green, that might not be understandable. We had a situation here with some of our internal analytics where we found out 2 months after the fact that one of our service delivery managers had no idea what the indicator was saying because he was colorblind. So always make sure that you use a combination of color and shape, right? Use red X's, not red dots. Use green check marks, not green circles, things like that. So now that we go through our healthcare audiences, the first one we're going to talk about is the environmental services dashboard. So the things that are most important here is having those people in the right places and making sure that we're turning over rooms as quickly as possible. So one of the ways that we do this is using predictive analytics. So we look at historical patient data and we use that to predict when we think that patient will leave the hospital and how long it's going to take to turn over that room. So some of the factors that we include when we do this predictive analytics for environmental services is the unit they're in, right? Are they in cardio? Are they in neuro? Are they in the ER? And then we look at what procedures are performed, right? Someone who's had open heart surgery is going to be in the hospital much, much longer than someone who had, a knee replacement. So we want to make sure that we understand that. And then also by age, we want to look at things. So obviously, when you have an elderly patient, they're going to be in the hospital much longer for the same procedure than someone who's, say, in their 20s, right? A hip replacement for someone in their 20s or 30s is very, very different than a hip replacement for someone who's, say, 80. So we always want to make sure that we understand how we can get people in the right place at the right time.
Katie, can you explain how do you go about using the historical data to determine when a patient might leave?
So for that, it kind of depends on what the situation is. We'll look at the data and we'll use a variety of statistical techniques, right? So we'll use regression analysis. We'll look at those indicators for that patient, things I mentioned, like what unit they're in. We'll use those as indicators, and then age, and then the procedures performed, and we'll do a regression that, say, predicts the amount of days they're going to be in the hospital so that we know, room X we can expect needs to be cleaned at such and such a time. Additionally, sometimes instead what we'll do is we'll cluster patients into similar groups, again, based on the same factors, but instead of doing a regression analysis to predict, we might instead put patients into clusters, which is something used a lot in market research. We'll put them into clusters based on these factors. So, people who had joint replacements who are 60 to 80 might be placed in a group. And instead of using kind of like a prediction, we would use the average for that group and use that to make an assumption about how long they're going to be in the hospital. The second thing after that predictive analytics is to always make sure you have your team in the right, most efficient place. And this is where maps really come in handy for this type of role in your hospital. If they can make sure that they understand where the needs are, that's what's going to be most helpful. So you can see on this slide, we have this estimated time on the right hand and the columns on the right hand side. It has the estimated time remaining until that room is available. So you can see like the first 3 are in cleaning, and based on when they clicked that they started cleaning, we can predict that they'll be done in 8 minutes, 17 minutes, etc. Or as you can see in the bottom of the list, we know that people are awaiting a transfer, right? So if we can predict when that transfer is going to happen, we can have your environmental services staff in that area that the transfer is going to be, so they can turn over the room that patient is leaving. On the left-hand side here, you can see the various capacities by area, and then we use that kind of same predictive analytics and just kind of put things in a little bit more visible manner, that by unit, to see how many beds are available and when the next bed will be available, and look at that versus the need. Next, we're going to talk about a dashboard for nursing managers. So some of the things that we think are most important here, this is a good case where we use exception reporting, right? So in exception reporting, what you want to do is you want to identify where the needs are. You don't necessarily need to show all the data where things are great, right? And showing data where things are great is sometimes, a good, mood lifter, right? You want people to know that you think that they're doing a good job, but in this particular situation, if we can have the most urgent patient needs rise to the top, and those patients that, are out of compliance for that room, that can help us determine where needs are, so that we make sure that we're spending that limited time that you have from your nursing staff, we can make sure those people are in the right place at the right time. And this is another situation where we would recommend a map if possible. A lot of modern EMRs, as much as you would think that they would have some of this information arranged by maps, a lot of them don't yet have that capability built in. So one of the things that we focus on for users of certain EMRs is providing these things in a map format. That is super helpful for the nursing staff to lay things out visually and help them understand in their area what the needs are, as opposed to just providing them with lists of information. But you can see here we have the rooms with the lowest efficiency on the left-hand side. So these are rooms where we're making sure that we're capturing all the meaningful use data that we need to capture. So you can see that in the first room, we've only captured 18% of that information that we need. So that's a room where there's more assistance needed. And then the map here is just color-coded and has the rooms listed below. Next, we're going to talk about private practice physicians. So in this case, this is not a flashy dashboard, but at the same time, we want to make it as easy as possible for private practice physicians to fulfill, hospital physician needs. So for the private practice physicians, we want to show them a list of patients that have been admitted to the hospital. What is their location? What is the diagnosis that they were admitted with? We use those predictive analytics again to estimate the time they're going to be in the hospital and estimate the date of discharge, so that we can help them understand what the needs of that patient are going to be in the future. And then we also show any action items that are needed by the physician. So you can see here in this basic table, we would make this portal-based table, but you can see that, for example, Jane Smith, the second patient there, she has a red, or I guess kind of an orange circle or box there, because we need her to go back and verify the patient medication list for this patient. And you can see here just some of the items we talked about in the previous slide, that we just put those very simply so that the physicians can quickly look and understand what their patients look like. Then the next thing we're going to do is the ED director dashboard. So emergency departments have a ton of needs. And when we go into a healthcare organization or hospital to talk about what their needs are, we always end up talking about the ED because things move so quickly in the ED, and we want to make sure that we can give all of the hospitalists and the nursing staff a really good quick look at what's happening because things move fast in the ED. So the first thing we just want to show for that director, what's the status of my ED right now? So how many rooms are available versus how many patients are waiting in triage or out in my waiting room? What is the severity by room, right? Are 40% of my patients, high severity right now? If so, I need to make sure that all my staff are in exactly the right places because those patients are going to have, much greater and, needs that need to be satisfied most quickly. And then again, we're going to use the predictive analytics to estimate the time we think that they're going to be in the ED, when we think they're going to be discharged, or when do we think that patient is going to be transferred. If we've made the decision to admit them to neuro, when is that room going to turn over? When are we going to be able to put another person in that room? And then again, talking about the predictive analytics, what's the time remaining in the ED? And though in that situation, we would probably do some cluster analysis and put patients together based on that severity rating, what the diagnosis is, and then also their demographics. And then one of the things we like to show in the ED is the current trends versus like the ED patient trends by hour and by day of week. So if we go and we look at a sample set of dashboard panels here, in the lower left-hand quadrant, you can see that's where we're talking about that patient volume. So this is what's called a box and whisker plot.
Can you explain what that is representing, Katie?
Yeah, so if we look at this Sunday, just the entry for Sunday here, that top bar is going to be the 75th percentile. So for patient volume on Sundays, what is the 75th percentile? And this lower line here is going to be what is the 25th percentile for patient volume on a Sunday. And then this box here will represent kind of more of a middle range with the line in the middle. You can see it a little better on Tuesday or Friday, but that dotted line is going to be the average, and the straight line is going to be the median, so the 50th percentile. So we just like to be able to show so the orange bars are this week, so we like to be able to show the ED director, your worst Sunday ever, you had 200 patients, and this past Sunday you had, say 120. So we like to be able to benchmark for them how this rates against, some of their worst Sundays, and also use it to help them understand what their staffing needs are going to be by day of week. And then also we'll typically show this same box and whisker plot by hour of the day as well. And then here you can see this pie chart that just shows the ED visits by severity level. So in this case, 60% of the patients were considered to be urgent. Only 1% of patients were considered to be immediate. And then you can see that we have some less urgent patients in as well. Up here in the upper right-hand quadrant, this is just going to be that table with some of those predictive analytics. So you can see that, in room number 1203, we project that patient will only be in the room for an additional 12 minutes. They were diagnosed with the flu and pneumonia. You can see the ICD-9 code there, and then also the patient disposition. So we've decided to discharge the patient in room 1203, and we expect them to leave in the next 12 minutes. And you can see we go through that for some of the other areas. So in the third line, we have an admit. We project that they'll be moved to neuro in 65 minutes. And then we can see here we actually are transferring someone out of the hospital in the last line, and we project that person's transfer will happen in the next 100 minutes. And then finally, the bottom here just shows for yesterday, for all the patients that left, where did they go? All the patients that we transferred out. Did they go home? Did they go to another short-term hospital? You can see in some cases we sent people to a cancer center or a children's hospital. But luckily, it looks pretty nice here. We didn't admit that many patients. So in some ways, that's a nice thing. Next, we're going to talk about surgery directors. And here, so many things about what a surgery director thinks about is room utilization. To have a surgery room and just to build one in OR is so expensive. So you want to make sure that if you're building one, that it's being used. In some cases, in certain hospital networks, we've helped them do some consideration of whether or not they should build another OR, and in some cases that OR can cost up to $42 million. So you want to make sure that you're going to utilize that room. So we want to show them for the facility, what's your room utilization today? What are you on track for today? And how did that match for yesterday? And we'll typically want to put a KPI on this as well. So we'll say, we on a daily basis hope to have 80% of the time slots available in that room booked. But yesterday you might have only done 76, but today you might be on track to do 90. That's super important, and sometimes we'll show that by specialty too. So, is neuro using the most time in your ORs? And if so, can you make sure that, the dollars associated with that are high enough? As much as healthcare is about helping people, you have to run efficiently, and so utilization is really about that. And then for facility metrics, we'll also want to show a little bit about how much time people are spending in PACU. Typically, there are clinical quality measures associated with PACU, and so we want to make sure that we're showing that as well. And then production metrics, we always want to show these for the surgery director. What surgeons are the top performing surgeons? We look at that by case volume and also by dollars, because open heart surgeries, you're going to have someone who does open heart surgeries might have 4 a week, but someone who does endoscopy would have 50 a week, right? So we want to make sure that we illustrate the difference between dollars and case volume.
Should the providers be able to see their fellow surgeons' performance metrics?
There are studies that show that you can get the most out of your surgeons by actually comparing them to other surgeons and doing that publicly. If you think about the process of becoming a surgeon and getting into med school and getting into residency and all of those things, all of that is very competition-based and very competition-driven. So hospitals find that when they show how surgeons are doing versus each other and how surgeons are doing, versus the median or the average, if you don't want to show all of the other surgeons, in some cases you might just want to compare them against, the median, the 75th percentile, and that's going to give them a good indication of how they're doing, and that will drive them to do better, to be better. So I would always recommend, if your surgeons and your surgical staff are comfortable with it, that you show their metrics to one another, because that really drives them to do better and be better, which obviously helps, make you money and save you money. So if you look here at kind of a sample dashboard, in the top right panel there, we have the top surgeons by volume and the top surgeons by revenue. And you can see that in this sample, we show who they are, what their specialty is, and what those volumes are versus revenue. In the upper left, we're showing the patient wait times. We want to make sure that we're not having patients sit forever in PACU or in pre-op. So we show this bar chart here that shows, for OR4, those patients are spending the most total minutes in the surgery process, and most of that is the average discharge time. So the time from PACU to discharge. And then in the bottom two, these are pretty basic. On the left we have just patient counts, and then kind of the admits and comparing those case volumes. And then on the bottom right, it's just a basic utilization chart for each room, how much of the time is being utilized. And our next and final, hospital role that we're going to talk about is a hospital president dashboard. And this is going to be, a combination of all of the different areas. They need to have kind of a bird's eye view of what's happening in the hospital. So some of those things that we're going to focus on is the surgery revenue and utilization, census. So how many patients did we see? How many did we see in the ED? How many were admitted? What were those census numbers for the last month or the last year even? And then we want to look at ER, make sure the ER is running efficiently, and then finally we'll look at those financial metrics because those are very important for the hospital president, and then also everyone that they report to. Those financial numbers are very important. So here we have kind of a 6-panel sample since they need to see a lot of different things. So this upper left-hand dashboard is the payer mix. So how many of our patients that come in are self-pay, and then how many do we have of the different carriers, just looking at what we can expect to see, because that payer mix definitely drives revenue, especially when we talk about adjustments to charges and all that kind of stuff. Then the middle is just that basic census data. So you can see here this top line is the ED volume, and then you have the admits for observation and the admits to inpatient below. So you can see kind of how the ratio of those things changes. In the top right corner, you can see the different emergency rooms and how are they doing on average length of stay, right, from arrival to departure. Right now it looks like these are all pretty comparable. So, assuming that that's a good metric, or those are good times for what your KPIs are, these are all pretty competitive, which is good. In the bottom left, we have the top 10 diagnosis groups. Just so you can get an understanding of what are we seeing the most people for. Based on that, do we need more of a certain, staff type, more of a certain ND specialty? That's a really good metric to understand who's coming in and what their needs are. And then these last two panels, the middle bottom and the bottom left or bottom right, those are more financially oriented. So the first one is the revenue versus the self-pay revenue for the last 12 months, and then the one next to it is the outpatient factor for the last 12 months. So how much of our revenue is coming from outpatient procedures versus emergency room and admits. And so that's all that I had. Are there any questions?
Well, if there's no questions, then we'll go ahead and wrap things up. Katie, thank you for presenting Optimize Your Day with Dashboards, and Rick, thank you for emceeing our webinar. Following the conclusion of the webinar, we will be sending out a recording of the presentation as well as our dashboards guide. Thank you.
Thanks.
Thank you.